Hello ladies and gentlemen, and welcome to another Manual Monday. Today our topic is anterior hip impingement. So anterior hip impingement is a condition that affects a lot of people, especially young athletes as they get older. What it typically is characterized as is a sharp or stabbing pain in the front of the hip, especially whenever you're standing from a lowered position or a sitting position over time, and a little difficulty getting fully extended through that hip, and again like a sharp stabbing pain through the front of the hip. So what we're going to discuss today is some manual treatments and techniques to help address anterior hip impingement, and I hope you enjoy.
Hey guys, this is Travis again. So today we're just going to talk about a posterior inferior hip mobilization. This mobilization is a good way to separate the femoral head from the acetabulum. So what I'm doing here is I'm taking my hands, putting it in the femoral crease. I'm scooping the hip towards me, and then also pushing the hip forward with my shoulder as it rests on my shoulder. And then I'm also giving slight mobilizations towards my body to increase that inferior mobilization of the hip.
As seen here in the video is a capsular mobilization or a hip mobilization to improve capsular motion at the hip joint. Oftentimes with hip impingement, capsular motion is lost, creating a scenario where impingement occurs at the anterior part of the capsule. In the video is a posterior to anterior mobilization to help improve joint space, improve muscle function, and to help decrease pain where impingement occurs.
Hey everybody, this is Jonathan over at NeoLife Physical Therapy and Wellness, and today I'm going to be doing the weight-bearing hip mobilization portion of our hip impingement lesson. So the difference between hip impingement mobilizations and weight-bearing compared to non-weight-bearing is it's actually the opposite. If I'm doing a posterior to anterior or a PA mobilization with them standing up, it's the exact same motion as if they were laying down and I was doing anterior to posterior. So with that in mind, this will be from posterior to anterior. I'm still getting that same motion, it's just the opposite. Yeah. This will be lateral distraction. And this will be just the opposite, the left. All right. So there you have it. There's a weight-bearing portion of hip mobilizations for hip impingements.
I hope you guys enjoyed that video on anterior hip impingement and manual techniques to address anterior hip impingement. This is one of those conditions that typically affects a lot of people, and it causes a sharp stabbing pain in the front of the hip when they're standing from a sitting position over time. Again, always consult with a medical practitioner before you start really approaching treatment techniques for these conditions, because you want to make sure that you're treating the right thing in the right way. Again, I hope you guys enjoyed this video, and on Wednesday we'll be discussing therapeutic exercises to address anterior hip impingement, and we'll see you guys then.